Hello, in this presentation we're going to look at occupational therapy perspectives on anxiety disorders. So anxiety disorders impact client factors in many different ways, but it really depends on the disorder and on the client. So you'll want to take a look at what the specific symptoms of the diagnosis are, and then what your client needs to do, wants to be able to do, and what occupations are being affected in the first place. And that will help you to identify some of the client factors that may be involved. So looking at the various symptoms of anxiety disorders, we know that many global mental functions are affected. Someone's sleep can be affected, their temperament may be affected. And then specific mental functions such as their ability to attend to the environment or to the task. And keep in mind that that can be sustained attention, so staying focused for a period of time, or their ability to have divided or shifting attention so that they can go between items that they need to focus on. So their attention may be affected. Their ability to recall or remember information can be affected. Their ability to problem solve or make decisions, and this can show up in things like poor time management, disorganization in terms of their day-to-day life. So many IADLs can be affected because of these specific mental functions. Their emotional self-control may be affected, and that can show up in social participation and at work, in education, depending on their ability to manage their emotions and to relate to others in an effective way. So many body functions and body structures can be affected as well. Remember that anxiety can cause people to feel shaky, to experience muscle tension, backache, headache, fatigue, increased heart rate, hyperventilation, can cause GI symptoms of diarrhea and nausea, and decreased libido, and also just sort of decreased initiative for really any occupation. So keeping in mind that all of these things can be symptoms of anxiety, they may be affecting someone's ability to perform their desired occupations as well. So speaking of areas of occupation, really any and all areas can be affected. Depending again on the client and also on the diagnosis, we may see really any of the 8 areas of occupation affected. And I picked this as our graphic for this because I think it really, they say self-care, but we know that a lot of these things go beyond ADLs. They're talking about cooking and tidying, which are IADLs, cuddling cats, which could be considered leisure perhaps, or even health management and maintenance, reading, which could be a leisure interest, gardening, which may be leisure, getting a hug, which is very much social participation, as is talking to select people. So you can see on here that the types of things that people do to keep themselves well, to manage their anxiety or the depression that can come with anxiety, these are things that involve all the different areas of occupation. And if any one of these isn't going well because of the anxiety, their ability to take care of themselves may be affected as well. So OT interventions, this is just kind of a quick overview, definitely not an in-depth look at what OTs can do. But certainly we can address a person's ability to relax and manage stress, and there's all different ways to do that. Leisure, any of their leisure interests may help, addressing things like sleep, using yoga, using meditation, whatever the person is interested in, adapting their environment so that it can be a more relaxing environment may help as well. So there's sleep on the list, and there's those environmental adaptations. Increasing leisure and social participation as the person is able to can be very helpful to them, to help them feel more connected and more sort of in touch with their own environment and their own interests and sort of what makes life meaningful for them. Supporting their functioning in education, work, and IADLs. Of course, ADLs are important too, but these are the three that are most affected by anxiety. Addressing performance skills and client factors as much as possible. So if someone's experiencing things like headache and backache, giving them some strategies and some techniques to decrease those things, increasing things like attention and memory, with ultimately the goal of increased occupational performance and participation. And then establishing and restoring performance patterns. So addressing habits and routines that may support their wellness and getting them back to their desired roles. That's it for now. Thank you for watching.